In this, the second of 4 e-learning modules, you will be introduced to process tools that describe systems of care and support your improvement efforts. We will explore tools that determine root cause or causes and why something is happening, in addition to process mapping, which clarifies what is happening. These tools support the decision-making around change ideas and inhibit a jump to implement a specific change without consideration for what else might be happening in a particular system. After this session, you will be able to identify QI tools that assist in the determination of root or system cause, affinity diagram, cause and effect diagram, ISHIKAWA, and PARETO diagram, 5 whys, process map. The affinity diagram is a tool for organizing information across themes and is helpful for teams when they are attempting to identify the causes of a particular problem. It supports the concept of brainstorming, which enables each team member to share his or her perspective on the problem of opportunity for improvement. Following a brief period of brainstorming, teams are encouraged to identify themes that arise from the ideas and then to group, analyze, and prioritize for action. The themes that arise from an affinity diagram may be useful as the bones on the cause and effect diagram, which we will come to in a few moments. The number one source of change ideas is brainstorming with your team. Brainstorming creates lots of ideas. Don't assess, don't judge, just gather the ideas. Have your brainstorming group represent as many perspectives as possible. It's like popcorn in a microwave. When the popping slows, you better get it out or it will burn. You want to get lots of ideas and then stop before people run out of energy. The minute you start hearing ideas come a little bit slower, just call a halt. If people have a hard time getting started, identify themes. Gather ideas around a particular change concept or step in the process, and write the ideas down, all of them. Using the space provided in your workbook, think about the strategies that can be used to support patients to transition from hospital to community. As you list the strategies, begin to cluster them with similar or related strategies. For example, providing a patient with a discharge summary upon discharge is similar to sending a discharge summary to the primary care provider electronically once the patient is discharged. Both are forms of discharge summary communication and therefore have affinity to one another. Contrast this with a strategy that focuses on community support, such as referral to CCAC. It would be a different strategy. Remember, with brainstorming, there is no judgment or discussion of what is shared, as the goal is to generate as many strategies as possible in the time permitted. Now that you have listed a number of strategies, reflect on the themes or clusters of ideas that were generated. Which strategies lead you to improvement changes? Can you explain why? The next tool to support system diagnostics for your QI project idea is the cause and effect diagram. Cause and effect diagram. A fundamental tool that identifies and predicts potential failures in a process or system. Helps groups brainstorm to identify potential causes of a quality problem. Delineates forces that either help or hinder reaching the desired outcome. Cause and effect diagram. Write the quality problem in a box at the right of the diagram, the effect. Draw the spine, a central line across the diagram. Draw diagonal lines connecting to the spine, the fish bones. This is what the diagram looks like. You can use as many or as few bones for your QI work, depending on the topic and clustering of causes. These categories are commonly used in healthcare improvement cause and effect diagrams. However, you may wish to use categories that are more aligned to your project and/or use themes that arise from the affinity diagram. Each bone is named under these standardized categories. However, you can assign different titles depending on the QI topic. Teams sometimes use the affinity diagram exercise to identify categories under which causes are listed. Cause and effect diagram. Identify different causes and categorize under the most appropriate grouping. 1 to each of the smaller bones. Brainstorm. Make sure to work on all categories. Once you have the diagram completed, you can review and analyze each element on each of the bones. Ranking the causes and deciding on action is the last step in the cause and effect diagram. Sometimes teams find that measurement related to a particular cause is needed to better understand the frequency or details surrounding the cause. Other times, teams choose to vote on the most impactful cause from each team member's perspective. Take some time now to apply the cause and effect diagram to your QI project idea. There is a sample diagram in your workbook that you can use for this exercise. You may wish to pause the video while you work on this. In addition to the information you can gather from a bar chart, Pareto diagrams display the cumulative contribution of each category. It helps you identify the category that is most important, which makes the most significant contribution. This is particularly useful when you're trying to identify your biggest problem. Which category is contributing the most angst to something? Pareto diagrams are named for the Pareto principle, or the 80-20 rule. In anything, a few, or 20%, are vital, and many, 80%, are trivial. Applying a Pareto diagram to categorical data allows you to focus your improvement efforts. This case study will provide the context for the development of a Pareto chart. This data collection sheet outlines the categories of causes from the team's tally sheet that are perceived to influence readmission to hospital. To build a Pareto diagram, the team sorted the categories on their bar chart according to magnitude of each cause's contribution to the problem, from large to small. They calculated the percentage contribution for each category. Note that the x-axis is the categories and the y-axis is the unit of comparison. The next calculation is the cumulative impact on waiting times. Here's what the chart looked like with the categories of causes displayed as bars and ranked in order of most frequent. Count on y-axis for comparison. Then the team drew the graph with the different causes along the x-axis in order of their contribution. The y-axis showed two values. On the left, the tally in each category, and on the right, the cumulative percent contribution. The collected data was then entered as vertical bars. The team then entered the cumulative percentage contribution following the right-hand y-axis, showing 100% at the top. A line was drawn connecting the cumulative contribution percentages. This is what the chart looked like. The red line displayed the cumulative frequencies of the readmission prevention categories, which from a QI lens are opportunities for improvement. The challenge is, as a team, do we work on all of these categories? Most teams cannot do that, and based on the tally sheet numbers, it may not be worth it to work on every category of causes. The team then applied the 80-20 rule to identify the categories that contribute the most to the problem. A horizontal line was drawn at the 80% point of the y-axis, across to the cumulative percentage line. In the upper right corner of the chart, you can see where the horizontal line, approximately at 80%, intersects the cumulative percentage line. Having determined where these two lines intersect, the team dropped a vertical line from that point down to the x-axis, enabling them to identify their vital few causes of the problem. The few vital causes, or the categories of causes that the team will focus on for change, are to the left of the vertical red line. These categories of causes most contribute to the readmission challenge based on the team's tally sheet of readmission causes. A Pareto chart is extremely helpful when team members are not in agreement about causes to focus on from a change perspective. Measuring the contribution of several causes to an effect can demonstrate where the most impact will be from change. In this example, the team should focus on improving primary care physician follow-up, discharge summary completion, referral to CCAC, and the use of telehome care. Focusing on medrec, pulmonary rehab, hospital follow-up, and air quality in patient homes is less likely to have an impact on the readmission rate. Here is an example of a Pareto chart from one of our academic sites. It is interesting to see the 80% categories highlighted in yellow. Is that what you and your team would expect in relation to where you should focus the change for this project? This team was surprised that providers not explaining the instructions was not contributing more to the low screening rates, but based on measurement, were able to focus the project on changes as per the highlighted yellow rows. 5 whys, a common approach for preschool children. It is helpful to use the 5 whys for some of the causes on the cause and effect diagram to better understand the contribution to the effect. Process maps are a common QI tool and are used to create collaborative awareness of current state related to a process, reflect on current state, identify specific opportunities for improvement, develop or visualize an improved future state process, and develop a common understanding of the process, cycle times, roles, and responsibilities. 2 important guiding principles for process maps are: include just enough level of detail to support your improvement activity, and involve everyone who has knowledge of the day-to-day workings related to the process under improvement. Too much detail will bog down the team and may not be necessary to describe the key elements of a process. Not having the individuals who touch the process participate in mapping is a risk, in that you may not learn exactly what is happening. Everyone's perspective matters. These are the core process map symbols. While there are many more, you will be able to build a robust process map with these 4 symbols. Step 1. Use the oval symbol as the start and stop points of the process. Do not assume that everyone is in agreement about the start and stop of a process. Sometimes it requires a conversation to ensure that there is consensus on the beginning and end of a process under improvement. Step 2. Outline the high-level steps. The number is important, no more than 9 to 10, so you don't get too detailed and into micro-process steps. Step 3. Outline more detailed steps to each high-level step where appropriate. For simple processes, this may not be necessary. The process map depicts steps in the process that denote whether they are serial, happening one after another, or parallel, happening within each serial step. For example, a patient who enters a family medicine practice, serial step, may register with reception, meet with an RN for a weight or BP measurement, and wait all within the waiting room or reception area, process steps. Here's an example from one of our academic sites. Note the diamond-shaped decision points at various points in the process. Times of cost data, if available, is valuable. Highlighting the team member who has a role or responsibility for a particular step is also helpful and can illustrate the workload or bottlenecks that sometimes occur in our systems. For example, if several serial process steps are aligned to the RN role and there is only one nurse working in the clinic with a number of other healthcare team members, the process map will be valuable to see who is responsible for each step and what process steps can be shifted away from the RN. Process maps are important tools in QI to facilitate redesign, especially when we ask patients and families and/or team members to share their perspectives at various steps in the process. Once you have process mapped a process, you can analyze the system by looking for opportunities to be able to reduce bottlenecks, reduce delays, remove duplication and/or unnecessary steps, link steps to remove gaps in flow, eliminate rework, standardize practice to reduce variation in practice. Reorganize to improve efficiency and effectiveness. Example, reorder steps, do steps in parallel. Improve steps that are prone to error. The NHS, or National Health Service Institute for Innovation and Improvement in the UK, developed a process mapping approach called experience-based design that engages patients and families in the development and analysis of process maps for healthcare improvement efforts. Patients' thoughts, feelings, and perspectives are noted with each process step and used to guide the change ideas. Here's an example of a process map with patient and family emotions included below respective process steps. The emotive patient perspective provides insight into how we might co-design improvement for specific parts of a process. Process mapping. Encourage participation. Develop a process map and post it in an area where staff have access. Post the legend of symbols. Invite staff to add steps to the process which you may not have considered using the post-it notes. Leave the board up for a set period of time and alter your process map to include staff input as appropriate to your PDSA effort. Here's an example of a Toronto Family Health Team's referral to consultant's process map. This is posted in a hallway with the legend so that team members can review, reflect on their role, and add to the map. Let's apply what we have learned about process mapping to your own QI opportunity in your workbook. Start drawing a process map to define a process that is related to your QI project opportunity. It is helpful to stay focused on the current state versus what we think or would like the future state process to look like. You may wish to pause the video to allow you time to draw a map. Reflection. Process map. Did you observe anything different about the process now that it is mapped? You can combine a process map and a cause and effect diagram, a process-style ISHIKAWA diagram. This is a helpful approach to small processes where the cause or inputs are known as related to specific process steps. Here's an example. A high-level process map has been developed and potential problems or causes are highlighted via the bones for each process step. This merger of the two tools guides teams to focus on tests of change as well as specific parts of the process. Note the improvement change opportunity highlighted by the red stars. This is what happens if you add too much detail. Now you know how to identify QI tools that assist in the determination of root or system cause. Affinity diagram, cause and effect or ISHIKAWA diagram, and PARETO diagram. Process map, 5 whys. Please contact faculty at your site with any questions you may have.